Welcome back to the morning show here on Arise News. Joining me now is Dr. Nini Iyizoba. Now, she is a medical doctor who specifically advocates for women's health and an entrepreneur as well, a graduate of biology and medicine. Dr. Nini currently works at Kleinberg Medical, partnering up with other medical professionals to provide free health screenings to the general public. Welcome to the morning show, Dr. Nini.
Hi, Stephanie. How are you doing?
I'm good. How are you?
I'm fine, thank you.
It's great to have you on the show.
Thank you.
So
Thanks for having me.
Tell us first, how did you get into this space? Apart from studying, how did you get into this space in Nigeria? Because you're originally from, you're Nigerian, but you've lived in New York
I've lived in New York all the while, and I got back to Nigeria. And, I worked at Kleinberg for a bit, but I'm not working there right now.
Okay.
Working in Nigeria in the healthcare system is pretty different, and it's pretty tough, So right now I'm just advocating for preventive medicine and trying to encourage and teach people basically about how to live daily to prevent, diseases and trying to stay in proper health. That's it.
So, are there any diseases that are you're really passionate about?
Well, yeah, I'm passionate about women's health and basically preventive diseases like hypertension, diabetes, stroke, because that's what causes 80% of death these days. So I'm passionate about teaching people about what you can do to prevent these diseases because, in Nigeria, if you get sick, I'm sorry for you. Sorry to say that, but that's just the truth. Our healthcare system over here is really poor and, the government is not doing so much, to fund, doctors, healthcare, put an infrastructure in place to make people better. So it's better just not to get sick.
In the first place,
yeah.
So what are some of the things that we should look out for as women, especially? So preventions for what type of diseases? So you mentioned hypertension. So what are some of the things that we can do to prevent ourselves getting there? As you said, we live in Nigeria, and a lot of us watching are in Lagos as well. And Lagos is a very bustling city. We love our city, but at the same time, there's a lot going on that can cause hypertension.
Of course.
Traffic.
Of course. Traffic, I'm guessing you mean stress.
Yes.
Yeah, being that Nigeria is one of the most stressful countries to live in the world. Not just stress, but just, how you live daily. Like this morning, did you drink water? Did you exercise? It's about what are you eating? Are you exercising enough? Are you, managing your stress properly? Are you getting enough sleep? It's all about your daily habits, daily basically. This accumulates to proper health, and it keeps you out of the hospital and keeps you in better health.
Yeah, and what would you say for women in Nigeria is for you, your patients? What has been like one of the most what cases do you hear of often?
It goes from cancer to STDs to hypertension to diabetes, and I feel like most people don't put enough importance on their health. They don't go for regular checkups because these are all the things that if you do go in for regular health checkups, you're able to detect. But like I said, the government is not doing much, so people don't have the money, or it's either they don't have the finances to go into the doctors all the time, or they just say, you know what, it's not that important. So they don't go, and they wait till something happens, something big happens, because diabetes could be stopped. Hypertension could be prevented, heart disease could be prevented, but people it's either they don't know, they don't know better, they don't know any better, basically. So all these are, I advocate for preventive medicine because I feel like when people have the basic knowledge of what they should be doing, and if they are doing that, then they would prevent these diseases. Because there's no money to they don't have the finances to actually treat those illnesses when they become bigger problems.
So diabetes is something that a lot of people are experiencing here in Nigeria, especially in Africa. So what would you say? You said you can actually find out what's going on with you before you're actually diagnosed with it. So what kind of things should you look out for? Some of the symptoms?
Number one problem for diabetes type 2 is, obesity. People are just, packing on the pounds, and that's from what you eat every day, Everybody's on this fat diet. It's either keto this or low carb this. It's not about a diet, but about your lifestyle daily. Are you getting enough vegetables? Are you getting enough fruits? Are you exercising daily? Are you moving? Some people get to work at 8 o'clock and they don't move from their seats till like 5 p.m. in the evening. You need to move your body because that just produces inflammation. So all of this is a cumulative process to what causes diabetes. Your weight, your nutrition, your exercising, your habits daily. Actually, more than 85% of diabetes is preventable. So essentially, all of it is preventable. So if it's preventable, why are we still having it? People are dying daily from stuff like diabetes. Yeah.
It's all about prevention, really.
And by the time, and they don't go for regular checkups, because if you do go for your regular checkups, your doctor will be able to tell you, look, your blood sugar number is looking high. What can we do to bring it down? But no, they wait till like they have numbness in their feet, or they just get really sick before they go to the doctors, and that's really bad. We need to start educating people about go to the doctor before you get sick, not just when you get sick.
Exactly. Yeah,
right.
It makes a lot of sense. And tell us more about Revive Wellness.
Oh, Revive Wellness. It's my health and wellness company. It's basically we're promoting preventive medicine. You know, like I said, I think now in Nigeria, what we need to do is to shift rather than treating illnesses, but actually how to prevent illnesses. And it's all about what you're eating, educating people about like movement, being active. So it's a new approach to healthcare. I think people should focus on more being preventive rather than treating the illnesses.
Yeah.
So that's what Revive is about. It's about educating people and giving them the resources to promote health and wellness before you actually get sick.
Yeah, no, you are definitely from the school of thought of prevention is better than
Yes, it is definitely better than cure. It's the best medicine.
It definitely is.
Yes.
Thank you so much for coming on the show. So tell us, how can people reach you if they want to ask you any questions?
Oh, sure. You can follow me on my Instagram page. It's Ask Dr. Nini. You could always email me. It's askdrnini@gmail.com. My website is drnini.org. Yeah.
And you also have articles that you write.
Oh, yes. I also write for The Guardian newspaper. I've been doing that for 2 years now. And basically just to educate people once again, because I feel like most people in Nigeria don't know any better. And I think when they do know better, they will do better, because that's your health.
Keep doing what you're doing.
Thank you so much.
You're educating people to live their best life, and we are definitely in support of that.
Thank you so
much.
much.
Well done.
Thank you very much.
Well, that's all from Dr. Nini, but she will be joining us again on Our Take. After the break, we have Temigiwa Tobuson, the founder and CEO of Life Bank. See you after the break.